By definition, a stem cell is a virtual infant cell that has the capacity to 1. Self-replicate, and 2. Differentiate or mature into a specific cell type, such as a bone cell, also known as an osteoblast, or cartilage cell, known as a chondrocyte. The vast majority of stem cells are obtained from the human placenta, processed no longer than 6 hours from the time of birth, obtained from only cesarean section births so as to maintain the highest standards of surgical aseptic technique, providing a sterile, non-contaminated source of stem cells. The woman donating her placenta has been declared perfectly healthy at the 6th month of pregnancy. Serological testing is conducted confirming negative status for HIV-1, HIV-2, hepatitis B, hepatitis C, syphilis, and Chagas disease, and transferred to a laboratory where small specimens of cubed tissue are procured from specific regions of the placenta to optimize stem cell volume. What happens next in our state-of-the-art laboratories is performed the same way worldwide, based on the 2016 protocol published in the Journal of Developmental Biology entitled Isolation and Expansion of Mesenchymal Stem/Stromal Cells Derived from Human Placenta. Having pored over this protocol word for word myself, and having personally toured and participated in this protocol at the facility in Guadalajara, Mexico, I can attest to the excellence of the sophisticated staff and technicians. They are highly trained, brilliant scientists whose attention to detail is above reproach and adhere to the highest levels of scientific and ethical standards. The surgically obtained placental fragments are placed in test tubes in the presence of enzymes that begin the process of dissolving or dissolution of the parts of the tissue that do not contain stem cells. This particular procedure must be performed in a meticulous manner as to not compromise the vitality and viability of the stem cells. The process of cell preparation, washing, separation, non-cell enzymatic tissue digestion, and eventually cellular isolation is performed with both machine and manually mediated precision to optimize cell volume. Once the centrifuge pellet of precisely purified stem cells are isolated, the remarkable magical culture and expansion begins. Physical therapy and cortisone injections have been the mainstay of non-surgical therapeutics prior to the advent of stem cell therapy. Here you can see an MRI rendering of a full-thickness rotator cuff tear that was treated with stem cell injection under ultrasonic guidance precisely at the site of the tear. Injection directly into the joint for chronic arthritis or instability of the shoulder, ball, and socket joint is easily achievable with ultrasonic guidance. This graph demonstrates percent improvements in pain and function over time. And this is a fascinating graph that shows the superior outcomes with cultured and expanded stem cell preparations compared to non-cultured stem cells that have been simply centrifuged and concentrated. Tendons and ligaments and joints around the elbow are very responsive to stem cell and PRP injections. Recently, the American Board of Orthopedic Surgery declared regenerative therapy as standard of care for tennis elbow over surgical management. Inflammation within and surrounding the carpal tunnel, involving the ligaments and tendons of the wrist and hands, can be greatly relieved by immunomodulatory anti-inflammatory effects of stem cell injections. Patient testimonials have been very encouraging regarding the effectiveness of stem cell therapy for joints of the wrist and hand. Now, moving on to the lower extremities. Hip joint surrounding tendons and soft tissue, inflammation and bursitis around the hip girdle can be easily accessed with superficial stem cell injections or ultrasonically guided intra-articular injection into the hip joint for osteoarthritis or cartilage problems, thus providing great regenerative therapy for all of these anatomic sites. Mechanical problems around the SI joint are also easily accessible. Perhaps the most commonly treated part of the body is the knee joint, with the structures inside the joint itself as well as the surrounding soft tissues. Here you can see the pre- and post-injection MRI images of a near complete tear of the ACL, that ligament, in this patient with acute instability. You can clearly see the remarkable regenerative capacity of the ACL tissues following ultrasonically assisted stem cell injections. Most regenerative stem cell therapy is focused on regenerating the articular cartilage defects, or, in other words, trauma to the surface of the bone, or stabilization and regenerative effects on the meniscus cartilage. Regenerative stem cell and PRP therapeutic injections can dramatically improve the symptoms at this site, as well as regenerate the chronically torn, inflamed tissues associated with with chronic, repetitive pulling, tugging, and tearing at this site. The regenerative and anti-inflammatory therapeutic applications at all of these sites provide great relief and successful clinical outcomes.